So today we are going to start and study about vitamins. Okay. So let's start the class. So vitamins. So vitamins, why we need vitamins? Vitamins are very, very important for our growth. Okay. So if there is abnormality in the growth, so there is an issue in the vitamins. So I'm not consuming the vitamins which are required for the body. Okay. And for maintaining immunity, health, and as well as organism. Whatever organs in our body are there to maintain the normal function. Okay. To maintain the normal function, we need vitamins. Okay. So we will take direct or indirectly daily in the diet. Okay. Most of the vitamins to maintain the health, to maintain the growth, or to maintain the function of organism. Okay. So basically, there are two types of vitamins. Some are fat soluble. Okay. Some are water soluble. So everything we'll discuss in this chapter in detail. Okay. So vitamins may be regarded as organic compounds required in the diet in small amounts to perform specific biological functions for normal maintenance of optimum growth and health of the organism. So why we required vitamins? Biological functions means the function is required for living purpose. Okay. So to maintain the living function of organism, we need vitamins. Like example, our eyes required vitamin A. Okay. The deficiency of vitamin A leads to blindness. So the normal function of the eyes is to see an object, for seeing the entire world and utilize as a sensory thing. Okay. By seeing, you can understood what we required, what other requires, everything. This is a function, biological function. So what happened? For seeing purpose, for the eyes, we need vitamin A, mainly for color, to maintain rods and cones which are present in our eyes. Okay, vitamin E is very, very requirement. Okay, if the deficiency of vitamin E is occurs, so what will happen? The blindness will occur, mostly night blindness. The eyesight will increases. Okay, so that's the reason we need the vitamins for our biological functions. Okay. So how it discovered in the beginning of 20th century, okay, understood that the diets containing purified carbohydrates, protein, fat, and minerals were not adequate to maintain the growth and the health of experimental rats, which the natural food such as milk could do. So means after observing a long duration, so initially the experiment will done on uh, rats, animals, goats, everything, dogs, whatever animals are there. Okay, so they absorb by giving carbohydrates, by giving proteins, fat, minerals. Some sort of deficiencies are seen in these animals. Okay, so they absorb that we need accessory factors. Okay, means they named as nutritions which are present in natural food, like in like milk. In the milk we have calcium, vitamin D, and other substance. So they are vitamins. Okay, so in the 1913, okay, so they absorb that whatever the rice, they have rice, we eat rice after polishing. Okay, so what will happen? The polished rice is utilizing nowadays. Okay, they absorb that whatever rice is there, okay, or rice in from the polishing rice, they are present and yeast. Okay, which can cure the beriberi in pigeons. Okay, so there's the reason he term those things as vitamin. Means vita means life. Vita. Okay, vita means life. So the life required for the body. Okay. Amines. Okay, vitamins means essential factors for the life, whatever essential factors are there. So both combine the word vitamins life. Amines means accessory factors, required things for the body, for the life. So at last the term as vitam vitam vitamin. Okay, so later in 1915, McCollum, Davids, everything discovered vitamin A, vitamin B, and vitamin C. Vitamin A is a fat soluble. Okay, vitamin B is water soluble. We will discuss. Vitamin C is discovered when scurvy. It is a disease. Okay, malnutritional disease. Vitamin A. Okay, I told you that it will bring night blindness. Vitamin D, anti-rickets factor. It means rickets, the degeneration of bones, anything will happen due to the vitamin D deficiency. And vitamin E is a fat soluble. Okay, so whatever these vitamins, if they are failed, they are not getting proper from the diet. What will happen? The production will not happen properly. Okay, so at another vitamin K is discovered in 1930s. So whatever going on probably for their invention experiment, they discovered the different types of vitamins. Okay, the sequence of alphabets, it should have been F, but K was preferred to reflect its function coagulation. So A, B, C, D, E there, but after E, they added K. Why the K? The term coagulation, because it is anticoagulant. To stop the bleeding, you need to vitamin K. Like after vitamin C, it is water soluble. Vitamin B have complex like B1, B2, B3, B12. Here I giving B2, B3, B4, B5, B6, B7, B8, B9, B10, B11, B12 from B2 to B12. Okay. There are, so that's the reason we'll call B complex vitamins. Very important for nerve health. So we know that there are the two types of vitamins. Here the you can see this box, fat soluble, water soluble. In the fat soluble, A, D, E, K. Water soluble, other than B complex or B complex. Vitamin C, B complex. In the B complex, we have energy releasing hematopoietic. Energy releasing means with this medicine, with this vitamins, you can get the energy. Okay. Hematopoietic means with this vitamins, the blood production will happen. Okay, that is vitamin B9, vitamin B12, very, very important. Vitamin B, folic acid, vitamin B12, and as well as iron. Okay, these are very important vitamins. And the iron is a mineral, not a vitamin. Okay. So here, these are the vitamins, fat soluble, water soluble. In the water, fat soluble, A, D, E, K. B, C is gone in water soluble, A, D, E, K. Okay. So we'll discuss what is meant by fat soluble, water soluble. First, we'll do fat soluble. Fat soluble minerals. The four vitamins A, D, E, K are fat or lipid soluble. Their availability in the diet, absorption, transportation are associated with fat. So that's the reason we will call fat soluble. Means they diet, mostly they diet present in the fat form, or in their absorption will happen in the fat form. Transport is required by the fat. So that everything is concerned with fat. So we named as fat soluble. Okay. They are stored in the liver. Mostly vitamin A, D, E, K are stored in liver and or in adipose tissue. Okay. And they are not excreted by urine. This thing we have to remember. Because if they were consuming extra amount, we will store in that area. And whenever we required, deficiency occurs, we will utilize from that area. Okay. If excess consumption will leads to toxic effect. Okay. This is not recommendable. Okay. Vitamin K has specific and water soluble. What is meant by water soluble? The water soluble vitamins are a heterogeneous group of compounds since they differ chemically from each other. The only common character shared by them is their solubility in water. Most of these vitamins are readily excreted in urine. They are not toxic to the body. Water soluble vitamins are not stored in the body in large quantity except B12. For this reason, they must be continually supplied in the diet. So water soluble means if you take large amount, there is no harm into the body, and because they are not storing in the body, okay, they are excreting. If excess amount is excreting from the urine, except vitamin B12. So vitamin B12 is storing in the body, and water soluble, and they are directly absorbing in the uh, without the help of fat, and they are going directly in the circulation. Okay, so this is the difference between water soluble and fat soluble. Deficiency of B1, vitamin B complex deficiency leads to neurological problems. Okay. So let's discuss one vitamin A. So vitamin A is present in foods of animal origin. So however, its provitamin carotenoids are found in plants. So main vitamin A is present in animal product, or their byproduct means similar type of vitamin A is present in plants. Okay. So what it will cure? It will cure night blindness. Okay. So what Hippocrates, one of our greatest scientist in 500 BC, what it will he will prescribe patient liver in honey, which known to contain high quality of vitamin A. So the animal liver is advised to the patient with he have to take with the honey. Okay, in 500 BC. Okay, and it will cure number of large quantity of patient who have vitamin A deficiency. Okay, so we'll not go in the chemistry topic. Okay, because this is not advisable. Okay, and we'll not go in the absorption also biochemical functions. Okay, functions we will do, study. What is the function of vitamin A? Very, very important for vision. Definitely for vision, we need vitamin A. Proper growth. To growth our body also we need vitamin A. And differentiation, reproduction, and maintenance of epithelial cell. So epithelial cell, okay, you have to need to know about where the epithelial cells are there. Okay, reproduction of epithelial cell, maintenance of epithelial cells. This will happen in the presence of vitamin A. Okay, so who discovered vitamin A? The biochemical function, the function of the vitamin A is discovered by George Wald. He got Nobel Prize for this. Okay, whatever function is there, it is given here. I already told that the rods and cones which are present in the eye needs vitamin A. Okay, so we need vitamin A. Will not go in other topic. Color vision, everything. Just if you want to study, you can study by this book. So what are the sources of vitamin A? Vitamin A is present in liver, okay, kidney, egg yolk, inner, not egg outer surface, right? Egg yolk, milk, cheese, butter, fish. So nowadays fish oil is have demand in the market because of vitamin K and other things, and liver oils also which having vitamin A. So whoever patient come to your clinic with the eye problem, eyesight problem, okay, you need to not only see in the pathological way, you have to go into the food diet way also, because sometimes vitamin A deficiency causes blindness. So in the, if it is he is non-vegetarian, you can advise these things. He is vegetarian, along with vegetable, along with you have to avoid those food non-veg, and you can advise vegetarians that yellow and dark green vegetables. So every green vegetables have vitamin A. Fruits are good source of carotenes like carrot. Whatever red thing is that you can get the carotenes. A, they are the not completely vitamin A. It is a we can say that byproduct, or look like, okay, vitamin A. Like carrots, those the reason vitamin A is good present in the carrot, which will increase the eyesight. Spinach, pumpkins, mango, papaya, etc. So all these have vitamin A. So if his patient is non-vegetarian, you can advise non-vegetarian food. If he's veg, you can advise this food. Okay, vitamin A deficiency. What will happen? Vitamin A deficiency is due to the inadequate dietary intake. First, the patient is not taking vitamin A properly. Or second, there is an intestinal issue. The absorption is not happening. Third, if he is taking diet properly, absorption is happening is properly, but there is no restoration. Storage is not happening properly because he is an alcoholic person. Okay, so that's the reason they will have the issue of vitamin A deficiency. So what will happen? Deficiency will leads to night blindness. Already told. Zero thalmia means in the eye they have dryness. Okay. Whatever other deficiency, effect of growth. Already I told you that skin skeletal formation, growth retardation due to the impairment in skeletal formation. Effect of reproduction will happen, doesn't happen properly. Okay, effect of skin and epithelial cells. The skin cells will become rough, dry, and the keratinization of epithelials of gastrointestinal tract, urinary tract, and respiratory tract is noticed. Okay, this lead to increased bacterial infection. Vitamin A deficiency is associated with the formation of urinary stones. So what you will get one important thing here, that what is the one of the reason of urinary stones, that is deficiency of vitamin A. The plasma level of retinol binding protein is decreased in vitamin A deficiency. Okay, these are the things will happen. Hypervitaminosis A. What will happen if there is high amount of vitamin A? Okay, leads to toxicity. Includes dermatitis will happen, intracranial tension, long bones, tenderness, loss of weight, irritability, hair loss will happen, joint pains. Okay, what is the normal level of vitamin A? 20 to 50 microgram per deciliter. Okay, this is the things. So this is all about vitamin A and fat vitamin, fat soluble vitamin, vitamin A, D, E, K. So this is all about vitamin A and different types of vitamins we discussed. So we'll discuss vitamin D tomorrow. Okay. You can have any doubt, please ask.